Hi guys, Sam here from Live Well Health Centre, and today we're going to be talking all about osteopathy and pregnancy. So obviously when you're pregnant there is so much information, so many opinions coming at you from all different directions, particularly if you're a first-time parent, and it's hard to know what's real and what's not and what to consider. So today we're specifically going to be talking about your osteo journey during your pregnancy. So the first question that we always get asked when someone finds out they're pregnant is it safe to continue with your osteo journey and continue with your treatments as you usually would? And the answer is yes. So as long as you are having what is considered a normal pregnancy, you are safe to continue with any treatment that you previously would have been getting prior to pregnancy. The only time we ask you to talk to your OB is if you are experiencing what we consider a high risk pregnancy. It's always good to talk to your OB first before continuing on with any other treatments, and we as your healthcare practitioners can also discuss with them as well. So if there's any concerns that you have or they have, we can always communicate with them and make sure that we as a healthcare team are on the same page. The second question that we often get asked by patients is, why am I experiencing so much pain during pregnancy? And other than growing a human, which takes a lot of time and energy and effort, one of the main reasons you're experiencing pain during pregnancy is due to increases in hormones. So there's two hormones in particular that we consider, and that's your estrogen levels and your relaxin levels. So during your pregnancy, both these hormone levels become elevated, and what that does, it softens your ligaments and allows for what we would consider a natural birth. So if you're having a vaginal birth, we want the ligaments around the pelvis to be nice and soft to allow for changes during dilation. However, these changes in hormones aren't isolated to just your hips and pelvis. They happen all throughout your body, and it's not uncommon for women to also experience neck pain, back pain, pain in their feet, and even hands and wrists. They're areas that we really commonly see that experiencing pain in pregnant women, and really common areas that we also treat. So the most common areas that we treat, of course, would be the pelvis, and both the front and the back. And the reasoning for this will be your baby's position. So there's two most common positions that we see during pregnancy where the baby is sitting, either anteriorly towards the front of the pelvis or posteriorly, which is towards the back of the pelvis. So when you're experiencing pain towards the front of the pelvis, it's usually coming from this joint at the front, your pubic symphysis. This really easily becomes inflamed with extra pressure and extra load that we're experiencing during our change in gravity of pregnancy. And that can also spread to the ligaments in the front of the hips and in through the groin. So we're commonly treating through the hips and through the legs for those areas. And then the other area that we often see is pain in this area, so the joints in the back and this SIJ joint that sits through here. So it's common with this type of pain that we also see what people often refer to that sciatic referral, where you're getting that sharp shooting pain down the back of the legs. So we're often working through the lower back, working through the glutes, and even down into the legs to make sure we're relieving as much pain as possible. Other areas that we commonly treat is through the mid-back and through the rib cage. The reason we like to treat through these areas, it actually helps to expand the rib cage. So the rib cage is just that. It is a cage that wraps all around through the front and the back. And if you think about this area being extremely tight and squeezed, if that's tighter than we'd usually expect, then it doesn't allow for much room for the baby to actually move through the abdomen and the uterus. So by opening that up, it allows the baby to move extra and relieve some of that pressure that you're experiencing on your hips and pelvis. Again, a lot of area treating through the neck. Obviously, sleeping positions change during pregnancy. A lot of women do sleep on their tummy, which is a normal position to sleep in. But when you're told that you can't do that anymore, sleeping on your side is not the most common position to sleep in for some people, and we can see those changes through the neck as well. Again, all really common areas that we treat quite regularly. And as osteopaths anyway, we like to take a holistic approach and make sure everything's nice and comfortable. We won't be taking you back to your original state, so how you were feeling pre-pregnancy. We can take you back as close as possible, but our role is to support you and support the body through those changes for pregnancy and labour. So how do we treat these areas during pregnancy, particularly when you've got a bigger belly in the later stages of pregnancy? How do we continue your osteo treatment as normal? So the easiest way that we do this at Live Well is by using one of these pregnancy pillows. So these pillows in particular are actually made in Melbourne and ergonomically tested for a pregnant belly. So they just have a cutout in the middle that mum can lay on top of and comfortably lay face down. It's usually mum's favourite time of treatment because it's the first time in a long time that you can actually lay on your tummy. They come in 2 sizes, so we have one for early stage pregnancy as well as late stage pregnancy, and that means that you can comfortably lay on your stomach throughout your entire pregnancy, those 9 to 10 months that you're going to be pregnant for. The other way that we alter our treatment is usually when you're laying on your back. We don't want you being completely flat due to the pressure that can cause on your organs and your heart. So we can also lift the head of the table and place multiple pillows behind your back to make sure that you're sitting slightly elevated. So our role really, not to take you back to how you were pre-pregnancy, we really want to support those changes in your ligaments by giving treatments using soft tissue treatment, joint mobilization, as well as exercise. Exercise is really important during pregnancy to make sure that you're able to support that birthing process. If you have any other questions about how we can support you throughout your pregnancy, give us a call or book online.